Next question. A 35-year-old new patient come to hospital. After the assessment, she is diagnosed with acute appendicitis with severe exacerbation. The surgeon decided to remove the appendix as it becomes a threat to her body. The surgeon asked to admit the patient and ordered USG of abdomen and other blood tests for making a decision regarding the surgery. How do you report CPT code? So when you get a question, go and open your MDM table, then identify what is the problem given in the question. So the problem given in the question is acute appendicitis with a severe exacerbation, and that becomes threat to her body. Okay, so this particular condition comes under which category? One, acute illness or injury that becomes life threatening or threat to bodily function. Okay, there is one such category and it comes under high. Okay, in problem table it comes under high, one acute illness or injury that is threatening to life or a bodily function. So acute appendicitis with severe exacerbation that is threat to her body comes under that. So you got high in problem table. Then next, moving on to data table, what all are the tests ordered? The surgeon have ordered for USG of abdomen 1, then other blood tests, means more than one blood test the surgeon have ordered, but not correctly mentioned the number of blood tests. So anyway, you can't take it as high in data table, because in high I have already told you, you need to satisfy category 1 or at least 2 category of the total 3. Okay, but here only one category will be satisfied maximum, so you can't take it as high. It can be moderate. Keep it there and move to the risk table. In risk table, what management option physician surgeon have came across? It is given the surgeon decided to remove the appendix, and also in the last line it is given for making a decision regarding surgery. So decision regarding surgery, removal of appendix which have become threat to her body, means it is decision regarding emergency surgery. Okay, so that comes under high. Okay, so for problem table you got high. For risk table it is not high, it can be moderate. Okay, then for data table for data table it can be moderate but not high. Then for risk table again it is high. So since you got too high, we can select the MDM as a high complexity. Okay, then new patient, it is clearly mentioned, so new patient with a high MDM 99205. Then question number 12. A 15-year-old established male who presents for follow-up of his migraine headaches. Since beginning Topamax 6 months ago, he has had significantly fewer headaches. He stated he now gets a migraine less than once a month. He has had not any problem with medication, denies changes in vision, appetite, energy and sleep pattern, denies gait instability, no changes in family or social history. So this is an established patient of 15 years old, and he comes today for a follow-up visit of migraine headache. Okay, so this migraine headache is a chronic condition, and did the patient have any severeness of the condition? No. Okay, after taking medication Topamax max for 6 months, the patient is having actually a stable condition. Okay, he had no new problems. Okay, he denies change in vision, appetite, energy, sleep pattern, everything. Okay, so what is the assessment and plan? Migraine without aura and without status migraine is non-intraceable. Then the physician have ordered for some test, comprehensive metabolic panel, then CT of head. Okay, then it is given doing well on Topamax. Then the physician have ordered continue current medication. Okay, so go and open the MDM table. In the problem table, what is the condition? Migraine. Migraine is a chronic condition, and it is not mentioned about any worsening of the condition. So it is definitely a chronic stable condition. So one chronic stable illness means it comes under low in problem table. Then moving on to data table, 2 tests are ordered, comprehensive metabolic panel as well as CT of head, which comes again in limited category 1 of a data table. Okay, so you got in problem table you got low, data table you got limited. And risk table, actually topiramate medication is a prescription drug management. Physician have asked to continue the topiramate, means it actually comes under moderate, but since we have got problem table low as well as data table limited, means you can take it as low MDM. Okay, and in the first line itself it is given as established male. So established male with the low MDM is 99213. Next question. Mr. Martin, a 32-year-old established patient, is seen for management of his hypertension and diabetes. After monofilament test, doctor diagnosed the patient has diabetic foot ulcer and he needed the patient for hospitalization. What is the E&M code for this visit? So he is again an established patient, and what all are his condition? He have hypertension is there, diabetes is there. Okay, so hypertension and diabetes are some two chronic conditions, and the physician have ordered monofilament test. One test is ordered, and the physician have came to the conclusion of having diabetic foot ulcer for the patient. Okay, so this diabetic foot ulcer is a complication of diabetes, which means there is an exacerbation of the stable chronic condition. Okay, and we have chronic illness with the exacerbation as well as chronic illness with the severe exacerbation. What is the difference? If the patient is asked, if hospital level of care is needed, means you need to take it as severe exacerbation. Okay, since here it is clearly mentioned that he needed the patient for hospitalization, means hospital level of care is needed. Hospital level of care is needed means it is one chronic condition with the severe exacerbation. Okay, so one chronic condition with a severe exacerbation comes under what? High in problem table. Okay, so you got problem table high, then in data table only just monofilament test, one single test is there. Then risk table, need decision for hospitalization comes in high. So you got high in problem table as well as risk table, and established patient means the code is 99215. A 57-year established male patient presents to office to visit his physician due to swollen ankle, loss of appetite, insomnia, blood in urine, shortness of breath. So an established patient come to visit his physician with the many minor problems like a swollen ankle, then loss of appetite, insomnia, blood in urine, shortness of breath, etc. Okay, he have these symptoms in 6 months, but last week onwards these symptoms get increased. Here is the non-case of diabetes mellitus. DM means diabetes mellitus. Okay, then physician order him to take CBC, LFT, RFT and GFR. After the result came, he diagnosed with stage 2 CKD. Okay, so first identify what all are the problems. There are many minor problems mentioned like swollen ankle, loss of appetite, insomnia, etc. Then it is mentioned as diabetes mellitus, which is a stable chronic condition, and the results of the diagnosis of all these minor problem is stage 2 CKD. Okay, so stage 2 CKD means stage 2 chronic kidney disease, which is again a stable chronic illness. Okay, so the patient is having two chronic illness, diabetes mellitus as well as CKD, means you can take in the problem table it as moderate. Now moving on to data table, there are four tests mentioned in the question, ordered in by the physician in the question: CBC, LFT, RFT, GFR, which means category 1 of moderate as well as high is satisfied, but you can't take it as high because for meeting the criteria of high, at least two of the three categories should be met, but here only category 1 is met, so you can take it as moderate. Okay, so problem table moderate, data table moderate, means the MDM level should be moderate of an established patient. So the answer is 99214. Next question. Susan is a 67-year-old female and is referred by Dr. Roy with a suspicious neoplasm of her left arm. She has had it for about a year, but it has grown a lot these last few months. I had the privilege of taking a skin cancer of her forearm last year. So this particular female, Susan, have came to the physician with a suspicious neoplasm of her left arm. Okay, then what is the past medical history? The patient is having hypertension as well as arthritis. No allergy is mentioned. Then physical examination. On examination, she has a raised lesion. It is a little bit reddish and it's on her left proximal arm. It has little bumpiness on its surface. MDM, suspicious neoplasm left arm. My guess is this is a what, but it may be a keratoacanthomas. Dr. Roy thinks it is. So, this patient is having a suspicious neoplasm on her left arm. This physician's suspicion is it is a what? Okay, the physician's guess is it is a what, but first physician, Dr. Roy's guess is it is a keratoacanthomas, which means they don't have a final diagnosis. All these guesses like what, keratoacanthomas, suspicious neoplasm are all differential diagnosis only. What is differential diagnosis? Differential diagnosis are those diagnoses which are made by the physician before a conclusion. Okay, before doing investigation, what all are the diagnoses made by the physician? They are that are not final. Okay, those are called differential diagnosis, which means when you get a lump on the breast, it can be a cyst, it can be a tumor, like that. That cyst and tumors are what differential diagnosis. Okay, similar is the case here. This what keratoacanthomas are all differential diagnosis, not final diagnosis. Then after obtaining consent, we infiltrated the area with 1 cc of 1% lidocaine with epinephrine, performed a 3 mm punch biopsy of the lesion, and then I shaved the rest of the lesion off and closed the wound with 3-proline. So this physician have performed a punch biopsy and shaving and closed with the suture. Okay. Now go and take your MDM table. First identify the problem. The problem here is a suspicious neoplasm, which can be a wart or keratoacanthomas, means it comes under which category, which section of problem table. It comes under 1, undiagnosed problem with the uncertain prognosis, because the final diagnosis is not given, only differential diagnoses are given. So it comes under the category of 1, undiagnosed problem with the uncertain prognosis, which comes under moderate category. Right. Next, what is the management given here? The management is biopsy, shaving with the suture, which means minor surgery procedure is done. Minor surgery comes under moderate of risk table. So you got moderate in problem table as well as risk table means, and it is also given that how to identify if it is a new or established. In the first paragraph, last line, it is given, I had the privilege of taking a skin cancer of her forearm last year, means this same physician have taken off her skin cancer. Okay, which means she is an established patient for this particular physician. Okay, so established patient with a moderate MDM 99214.